We recently reported about the Youth Risk Survey that delineates problems among our kids, whether they're prone to violence, sadness, and suicide. It's authored by the CDC, and we reported that the Florida Department of Education just last week demanded that Duval County Public Schools stop asking local students to take the survey, a survey that DCPS has been administering since 2009. State Education Commissioner Manny Diaz said the CDC asks leading questions that may actually introduce risky behaviors to students, prompting them to engage in potentially detrimental activities. DCPS complied and will no longer issue the survey. What is at risk here? Joining me on the morning show, Elissa Barr, a professor of public health at the University of North Florida. Good morning and thanks for being here.
Thank you for having me.
So let's start with this, the fundamentals. This survey covers a variety of topics, everything from skateboarding to bullying to, yes, sexual promiscuity. In your opinion, are the questions developmentally and age appropriate?
They are. There's a middle school version as well as a high school version, and these questions were actually developed way back in 1991, so they have been true and tested over the years. They were developed by a team of leading health experts in the field, and the CDC has added and changed questions over the years as we've seen shifts in our community and the experiences of kids. So, for example, now we have a vaping question on there. We never would have had that when you and I were in high school. So it is an evolving survey.
So it adapts to lifestyle.
It does. It does.
So let me add to this that we asked the commissioner to join us, but never did get a response. To Commissioner Diaz's point, does the CDC ask leading questions?
No, I feel that these questions are very simple. They're very straightforward. Many of them say, have you ever engaged in this behavior? And then the students reply yes or no. Some of them do ask, at what age have you engaged in this behavior? And the very first option for kids is to select, I've never engaged in that behavior. So it's very straightforward. It does allow kids to tell us their story, to identify some of the real challenges that they're going through. And so as adults, I believe it's our job to listen to them and to use that data. You know, if there's no data, there's no problem. And that's really unfortunate. They're telling us about what they're experiencing, so we need to listen.
So Moms for Liberty Duval suggests that perhaps parents be given the questionnaire. And by the way, parents do have the right to opt their kids out. For the survey to be effective, how important is it that the kids themselves have the right to be anonymous?
That's very important, because if we want those answers to be honest, we need to remind our students that this is a completely anonymous survey. We want them to be comfortable when they take the survey, so they're, giving us those honest answers and really telling us about the experiences that they and their peers are going through.
So if the kids feel like their parents are hovering over their shoulder, they may not be very forthcoming?
Probably not.
So Diaz also wrote to DCPS, the primary focus of your district, talking about Duval County Public Schools, should be to educate children using standards-aligned instruction and to assist Florida students in avoiding risky behaviors instead of exposing them to sexually explicit concepts. In your opinion, does this survey in any way expose them to sexually explicit concepts?
No, I've been working in sex ed and reproductive health of adolescents for over 20 years. And, the media is the culprit here as far as introducing them to risky sexual behaviors and these concepts. The survey is meeting kids where they are. And so they're very reflective of the true reality that a lot of our kids are dealing with.
Is there perhaps an assumption on some parents' part that their kids are naive?
There could be, but I think the majority of our parents, they value this survey. They know what their kids are going through, and so they actually support it.
Do we as parents have an obligation to sometimes hear what our kids are not saying? And is that a listening skill that a lot of parents don't have?
I think that is something that our parents and our community needs to do, is to listen to our kids. They experience this stuff day in and day out, and so we have to listen to them. We have to engage them more in our conversations. I always include parents talking to their kids daily. They're getting bombarded with messages in the media about sex and other risky behaviors. This survey is about so many important topics. We always focus on the sex questions. So I encourage parents to talk to their kids, yes, about these topics, but about everything.
I mentioned it also talks about skateboarding and bullying. So Diaz says the DOE will develop its own survey. Is it more qualified than the CDC to do that? Does the DOE understand what this survey brings about in funding to community organizations and what may be at stake here?
The DOE, our Department of Education, they are experts in education, and that is their focus, understandably. The CDC, they are experts in health and safety, and because this survey is about health and safety, I think that they are very well versed in creating the survey. If the DOE could bring together, a team of mental health professionals and counselors to write the mental health questions, that would be appropriate. But as of now, the committee that they've put together, it's not comprised of mostly health education professionals, medical professionals. It's just not. So that's unfortunate.
All right. Thank you very much for being here. I do want to add, while Commissioner Diaz did not respond to our request to appear, the group that expressed its concerns about the content to Duval Public Schools, Moms for Liberty Duval, did in the form of a statement saying, "We believe our schools, under the direction of the CDC, were asking wildly inappropriate questions of our children, and that parents were unaware. It is our position that our public school district should comply with the spirit and intent of the Federal Protection of Pupil Rights Amendment. That is why we requested that the district require a parental opt-in rather than the assumed permission with option to opt out. It was troublesome to us that because these surveys were anonymous, any student who answered that they were suicidal or victims of rape would not receive any support from school counseling services. These surveys could easily trigger a post-traumatic stress response in a survey subject, and no one at school would be able to help them."